Hello, my name is Rae O'Leary, and I'm going to be sharing a bit about public health concerns and opportunities for sovereign tribal nations. I am the Assistant Director for Missouri Breaks, which is located on the Cheyenne River Sioux Tribe in South Dakota, and I'm a member of the Turtle Mountain Band of Chippewa, which is in northern North Dakota. My background is actually in respiratory therapy, was my first career, and then I expanded into a degree in nursing and then a master's degree in public health. And a lot of my work revolves around not only advocating for public health in the tribal community where I'm located, as well as surrounding regions, but research to support public health, essentially. So that's kind of a high-level overview of what you'll hear from me. First, I want to start off with orienting with who I am and where I come from. You can see, again, Turtle Mountain in North Dakota. I also spent a good part of my life in eastern South Dakota and Montana. And currently home is Cheyenne River, where you can see the beautiful picture from our family's ranch. You can see myself and my family with my 97-year-old grandmother. That's a photo from this summer, and I always like to include her and acknowledge her in my work because she's somebody who had a strong desire to become a nurse and help her community and didn't have the opportunity. So a lot of what I do and my motivation comes from her. So to start kind of with the public health issues linked to tribal laws, it's important to understand that Indigenous people as a whole throughout the entire world have dealt with disease, genocide, and erasure. And that often is the systemic result of settler colonial policies. And of course, there's a long history, and we don't have time to get into all of that today, but it's just kind of a foundational understanding that needs to exist before we can really think about how to combat some of these things in tribal communities. Tribal nations in the United States have inherent sovereignty, which basically means that Indigenous people were the first people of North America, essentially. And before colonization had sovereignty. There was no one there saying how to live, what laws to follow. They governed themselves. And that's something that has been upheld in treaty obligations with the federal government and continues to be acknowledged that at least federal tribal nations have sovereignty to self-govern. So there's a lot of nuance, but basically sometimes we have to look at who has jurisdiction in certain areas, and that could be the federal government, that could be the state. But as long as we're talking about sovereign tribal nations, the ability to govern lies within the tribe itself. And that's why there's an opportunity to self-govern in the area of public health laws and policies as well. I also want to note that there are over 200 state-recognized tribes that are actively working to gain federal recognition. There's a lot of benefits, of course, to federal recognition because of the treaties that are in place. One example of a benefit is the Public Law 638, which basically says that that there should be set aside funds and rights to healthcare and access to ownership of that. And that's something that can't exist unless there is federal recognition. So it's not only the federally recognized tribes, but the states that we need to think about as well that are actively petitioning for that federal recognition. The tribal public health emergency codes have occurred at a lower rate, unfortunately, than other government authorities, and that's something that tribal communities are actively working to address. One review done by the National Congress of American Indians in 2014 found 520 public health related codes, and they kind of categorize them into different areas, which include agriculture and food safety, alcohol, tobacco, and other drug policies, animal management and control. That's something that many tribes have to deal with on their own, and it is a public health concern. Emergency planning and management, that became very evident in the COVID pandemic. Of course, the most relevant to this is the environmental health and health data, health services like emergency care and clinical care, specialty referrals for medical care, things like that. Infectious disease management, again, COVID is very relevant there. Injury and violence prevention, things like traffic codes and things to prevent injury. Public health infrastructure, and then the health and cultural resource protections. So those are kind of the categories that NCAI uses to group all the potential public health policies and codes that exist for sovereign tribal nations. So if we look at some examples of public health policies, and these are ones that I have some experience or exposure to in my line of work. If we think about chronic disease prevention, there's been some huge wins, especially for Navajo Nation in the area of junk food tax. And that's something that they've been a leader in, and there's a lot of information online if that's something you're interested in looking at. But basically, it's implementing a policy to incentivize healthy food choices and take away an incentive to purchase unhealthy junk foods. Other chronic disease prevention policies is no smoking policies in public places. That's something that I have probably the most experience in when it comes to public health or tribal public health policies, and I'll get into a bit more on that in the next slides. And then breastfeeding is an area that I'm really passionate about with my maternal child health background. That's considered, a public health opportunity to prevent chronic disease, because we know that protections to support breastfeeding in the workplace or pumping or just adequate time and a safe space to do that encourages women to breastfeed longer. And of course, then that's going to reduce rates of things like obesity and chronic disease later on in life, both for the mother and the child. And then infectious diseases, this could include things like STDs, or the obvious recently is COVID-19 precautions, and we'll get a bit more into that as well. Injury and violence prevention, traffic violations, there's a reason that we need to tell people to drive slower in school zones, because that's been a public health issue in the past, and that's what sovereign tribal nations can do, is say this is not, it's not safe to drive, 30 in a school zone. Animal safety, domestic violence, child abuse, and elder abuse, those are all injury violence prevention areas that tribes can govern on. And then again, with environmental protections, some examples that I've worked in is burn bans during droughts. That's important because if the environment can't support safe burning practices, then that needs to be regulated, because if people are burning, that could be a public health crisis as well. And then proper disposal of trash and illegal dumping. Those are things that need to be regulated and monitored. So we are doing everything we can to protect Mother Earth. Water quality standards. Of course, there are federal water quality standards, there's state water quality standards, but that's something that tribes do have the authority to say, we believe that the federal and state water quality standards are not adequate. So we're going to make our own more stringent water quality standards to ensure that our population has access to safe drinking water. And then here, I just wanted to share some background on a bit of the smoke-free air policy advocacy that I've done on the Cheyenne River Sioux Tribe, which is what CRST stands for. I've led the Chunli Coalition of CRST since 2009, and our initial aim was to enact a policy that makes the reservation smoke-free in all indoor places. And the reason that was needed, of course, is because tribal sovereignty. At that time, and back in 2009, 2010, the state of South Dakota was negotiating, and there was actually a vote that went out to to pass a smoke-free air policy for all of South Dakota, but because of tribal sovereignty, the 9 tribes in South Dakota were not protected by that state policy, so it was on us to do our own. And this is kind of just showing a timeline. The big policy that we were seeking to pass took us 6 years to get passed, because in a community with very high smoking rates, it's not a popular thing to regulate. But that doesn't mean it's not the right thing to do, and that as public health professionals and a nurse that cares about the health of my community, that it doesn't need done, right? So for 6 years, we advocated for this policy. You can see that there was a lot of small policies that we had kind of worked up to the big one of making the entire reservation smoke-free. And those were things like smoke-free parks, more stringent policies with tobacco use on school grounds, our powwow and our rodeo grounds. These are all areas that we were able to get some level of protection against the dangers of secondhand smoke. And of course, it was a lot of momentum building too that led up to that big policy being passed in May 2015. And I just want to note that, of course, the work's not done when the policy is passed. There's a lot of follow-up and enforcement and protection of the policy that needs to happen to make sure that communities are getting the maximum benefit of policies that do exist. So this here is a framework that the Chunli Coalition put together, because at this time, I believe there's only 5 or 6 federal, tribal, or federally recognized tribes that have comprehensive smoke-free policies. And because it's kind of rare, there's a lot of other tribal communities that said, hey, we want to work towards that. What's the recipe? What worked? How can we do the same in our own tribal community? So I know there's a big movement right now across the nation of some incredible work that's going on related to the prevention of and cessation, I guess, of commercial tobacco use, but also the promotion of traditional tobacco in tribal communities. So this here framework is kind of a structure, I guess, that we put together to support other tribes in their pursuit to address commercial tobacco use and exposure, as well as promoting the cultural use of traditional tobacco. And you can see that there's 2 circles, and that is education and policy, and then an overlapping circle in the middle that is community engagement. And the reason for that is because education around tobacco or any public health policy or topic can't happen without an engaged community. And similarly, the policy can't happen without an engaged community. So there's an entire toolkit that I'll post a link to, and that's something that there's all kinds of resources for. This framework was built for tobacco prevention and cessation, but it's a framework that can be cross-cutting to COVID or breastfeeding policies or any tribal public health policy, really. But the idea is that we continue working. You can see that the arrows show a never-ending flow of work to be done, both in education and policy and community engagement. And the thing that connects all of these is, and makes them more successful, really, is incorporating cultural lifeways along the way. So we're not just using, a CDC approach in tribal communities. Not that there's anything wrong with CDC approaches or any other best practices for public health, but it's important to make it local and feel like something that the local community can connect to and that resonates with them. And that's why we do our best to embed cultural lifeways throughout the framework. So I just wanted to touch quickly, because COVID is so relevant right now, and tribes really had a big role to play because of the sovereignty. Again, the state and federal policies weren't necessarily applicable to federally recognized tribes. So a lot of the response to the COVID-19 pandemic fell directly on the tribes. And this showed kind of a lack of infrastructure to support a nationwide, worldwide pandemic. This is something nobody saw coming, but it's something that we can learn from our past experiences and hopefully make changes to make better position ourselves as sovereign tribal nations to respond to these emergencies in the future. So if we think about all the areas that the tribe had to address when the COVID-19 pandemic came, we're looking at adequate testing, reporting procedures. Again, then that it gets tricky with reporting because there's federal tracking, there's state tracking, and there's tribal tracking, and not always do those reporting systems communicate. So that's just something to be thinking about. Mandatory isolation and quarantine for people that do have COVID, mask mandates, contact tracing. Again, there are federal and state systems for contact tracing, but if your local nurses and public health professionals are involved in that, it's going to be a lot more effective in a small, tight-knit tribal community. Vaccine availability and promotion. Border patrol is something that Cheyenne River Sioux Tribe, as well as several other tribes, included in their response to the COVID pandemic. Healthcare, do we have adequate staff and equipment to respond to this? In-home prevention and treatment. So are we getting information out so people can do their part to prevent the spread and treat themselves if they get COVID or have access to treatment? Education systems. Of course, we know that the schools were really heavily impacted by the COVID pandemic, and that's something that the tribe had a role in supporting those schools to make sure that they were using safe practices and following guidance to reduce spread in the schools. Supply chain issues, of course, was a worldwide issue. Physical activity, can we still safely exercise, and what does that look like? What safeguards are there to support mental wellness during this pandemic that had a big impact on mental health? Cultural supports, are there certain cultural practices that aren't safe to do during COVID, or are there modifications we can make to the cultural practices to help them be more safe and less risky for COVID spread? Funerals, lockdowns, curfews. There's so many areas that tribes responded to the COVID pandemic. Some did better than others. Some had, better systems in place and infrastructure to respond in a quick way, and some really struggled. And what we know about the COVID response across tribes is that regardless of how progressive they were, there were a lot of risk factors in place that contributed to very high rates of spread of COVID, as well as higher rates of mortality and death from COVID, unfortunately. So these are, just a high level of various public health concerns for tribal nations, as well as opportunities for sovereign tribal nations to address public health. I also wanted to touch on just one slide of a different presentation on equity and reciprocity when it comes to partnerships with tribal communities. And this is not only public health based, but research based as well, because again, we have to have data and research to support these policies, to know what's going to work, what is needed even in tribal communities. So I'm going to talk quickly through this concept that is a work in progress for Missouri Breaks, that kind of shares a lot of what we've done in practice for many years at Missouri Breaks. As an organization, we've been doing research since the 80s and 90s and have been in this community and for decades at this point, and have worked very hard to establish trust with our community. And that's really been beneficial for our ability to do recruitment and do research in a good way with our membership. So you can see here that on the left-hand side, there's tribal community roles, and on the right-hand side would be external researcher roles. And kind of the overall flow of what we've always done and will continue to do at Missouri Breaks is starting with that research concept and study design, and then moving into the data collection and management piece. And then after we have all the data, then comes the results and the dissemination and getting those results into the proper hands so change can be made. And then finally, sustainable outcomes. So the research is not just kind of a flash in the pan. Here's what we know today about it, but how can this research be, or the information from the research be leveraged to have long-term impact for the tribal communities that are partnering in the research. So you can kind of see a separation of the different roles that I'll go through quickly. On the tribal community side for research concept and study design, in an optimal situation, the tribal community would be kind of the party identifying the problems and potential solutions that need addressed with research in the community. Of course, modifying any other research protocols or interventions even to address a health problem to make it work for that specific community. The tribal community partners would lead the development of the survey, the consent form, recruitment materials, because they generally are going to know what works best. If language is understandable in surveys and consent forms, sometimes what needs asked from an academic standpoint, there's a lot of tools out there and research instruments to collect information from participants, but it doesn't always translate or have examples that resonate with tribal communities. So there's some modifications that need to happen there. And then, of course, providing community expertise, recognizing the players in the local tribal community that have expertise in the research area and giving them a voice and a role in the research project. And then on the external researcher role side, kind of the role with the research concept and study design would be doing literature reviews on the problems or solution that the tribal community identified to see what's out there. What do we know is already working or has not worked and can be modified to learn from. Identifying those promising models from that literature review. Assisting to identify and secure funding is another one. And that's something that, of course, needs to be a partnership. But because tribes have so many other obligations and duties to address public health and even clinical health in general, it's very much appreciated when research partners can kind of take a heavier lift, I guess, in that effort to secure funds. And then, of course, with researchers, they bring to the table their subject area expertise. We couldn't do this without our partners. We acknowledge that. And that's something that we are grateful to have their research area expertise to bring to the tribal communities, but of course also acknowledging that the tribal communities also have their expertise as well that should be considered. And when it comes to identifying the problem and solutions that need addressed, it's really important for partners not from the community to take ownership and understanding kind of what works for the tribe and what the needs are, and what is the current knowledge, the tribal ecological knowledge, the tech that already exists, the history that might be related to whatever the topic is being researched. A lot of tribal communities have some form of community advisory board or group, and that's kind of an opportunity to run some ideas through local stakeholders, I guess, to see what are we focusing on here? What are the needs or not? Are there possible problems, solutions, or other future research needs that need to be considered? And then I think in that process of those conversations with key stakeholders in the tribal community, needs to be a lot of listening on the researcher side and then acting on that too, rather than bringing your own personal agenda to the table. Share, like, here's my expertise, and now share with me how I can be of assistance. So then when we move into the data handling piece on the tribal community side, you can see that generally the tribal communities take the lead in collecting the data with local staff. That's really been helpful for Missouri Breaks to always have tribal members and community members that know, relatives. It's not unusual for somebody to come in and talk about, the kids' ball game that weekend that you were both at, or how grandma's doing right now, because we're so tightly connected with our community members. That gives us a definite advantage to doing this research in a good way and knowing our community members and what will work for them. And then, of course, citizen science, identifying opportunities where the individuals themselves in the tribal community can take a bigger role in being involved in that data collection piece. Data owners, that's something that Missouri Breaks believes firmly, that all data collected on sovereign tribal nations belongs to the tribe. And there's special considerations that need to go into the storage of data to make sure that's done in a safe way, and also sharing that that we know basically the tribe's protocols and expectations on data sharing, and that we advocate to uphold those. And then the community perspective and training opportunities on analysis. There's been a lot of times when we get to the analysis phase of a study, and our local research assistants say, hey, what about this? This isn't something that I'm seeing being analyzed, but it's something that in my interactions with research participants, I saw frequently. And there's really important findings when we listen to our local staff on what their experience was on the ground. And then those training opportunities, that helps build capacity for the tribal communities to be more independent in data handling in the future. And then on the external researcher side of data handling, you see being involved in, data cleaning, of course, the technical data analysis. Of course, if there's people skilled in tribal communities to do that, that's amazing and definitely best. But our experience at Missouri Breaks has been, that's an area that we lean a little bit heavier on our research partners to assist with. And then respecting the tribal data ownership and data sharing protocols. I mean, it can be a big letdown if you put tons of work into a project and the tribe says, no, we're not comfortable with that being public or shared. But again, the tribes are the owners of the data and have the ability to say when or when not to share the findings. And I think it's really important for research partners to educate themselves on the specific data use policies that exist. Every tribe is going to be a bit different in this, but having relationships with those tribal decision makers and elected officials is a great advantage to working with them in a good way when it comes to the data handling and making sure that there's trust there, not only with the local tribal community partners, but also with the external research partners. And when it comes to dissemination, then this is the part that I get most excited about, because we put years and so many hours and effort into collecting the data. But really where it's exciting for me is getting to see that data in action. And in that is dissemination, making sure that that data gets into the right hands. So in the tribal community side, some of those efforts are multimedia. That could be radio, newspaper, infographics, posters around town, billboards, whatever it takes to get that message out into the community. Also presenting to local tribal leaders, because all of our research goes through the tribal leaders and is approved by them. We have a responsibility to take the results back to them and say, here's what we learned now, and field their questions and new ideas even that come from that. Also the professionals in the community, who are the professionals? If it's some interesting research finding that comes from a clinical standpoint, do our local doctors and nurse practitioners and nurses know about that? And are they using that in their day-to-day clinical practice? Or maybe it's something more social service related that we want to take to that department. So just kind of identifying the home basically of who needs to know this information and use it on an ongoing basis. And then when it comes to our research partners, it's important, of course, to prioritize the return of results to participants. So we're not only disseminating to like the community at large and those key stakeholders, but to the participants themselves as kind of a thank you to them for participating. What can they learn about themselves, their health, the environment that they're living in, and are there potential changes that they need to improve their health? The publication process, again, that's something that should be a partnership between tribal communities and external researchers, but generally the researchers would lead that with support and participation from the local community as well. And then supporting local presentations upon request. There's times when it makes sense for the local partners to do those presentations, but there's also times when our local community wants to hear from the researcher themselves. So that's something that, upon request can be arranged and really powerful if we have that opportunity. And then an ongoing commitment to sharing results in the tribal community. And these should be actionable results. Not all studies are going to have things that have like something we learned that has the ability to share and people to make immediate change on. But for the most part, thinking about, how can the community, how can the policymakers, how can individuals themselves use this information to create change and improve their health. And that's something I'm also very passionate about, is making sure that the participants get that information in a good, easy to understand way with actionable steps to say, hey, if your arsenic is high in your water, here's what you can do about it. And then giving them the tools to make those changes if they so choose. And kind of the ongoing commitment to sharing is, infographics and other media tools that can be used to make sure that we're really focusing on those key takeaways from each study and continually sharing those with our community members and partners. And then, of course, in the dissemination phase, it's important to recognize that, again, that there's most tribes have some form of approval process to be able to share that data. And it's really important that we're not just giving them a very academic publication to consider, but kind of a layman's summary. It should be the role of the research partners to communicate that in an easy to understand way. So when tribes do approve for publications, they truly know what it is that is being shared about their tribal community members and the health of the environment, for example. And then finally, there's sustainable outcomes. On the tribal community side, that involves identifying opportunities to implement programs. Sometimes a research project might result in a really exciting program that we know works, and then finding, again, a home for that to be implemented. And then advocating for legislative policy or practice changes. That goes back to the whole first part of this presentation, when research drives policy change. And knowing kind of what the community situations are and what needs and opportunities there are to address in public health policy. And then, of course, funding opportunities. It seems like every research study, we end with the conclusion that more research is needed in a different way or with a different outcome or question. So it's really ongoing. And that's where this arrow from the bottom of sustainable outcomes goes back again to the research concept and study design. And then, of course, when it comes to our research partners and their role in the sustainable outcomes, helping identify what those new research questions are, supporting the policy and practice changes. We don't expect our research partners to say like, oh, here's this great opportunity for a policy change. But if that's something that the local policymakers are interested in and there's support for, being there to present the research if needed. So, or identify, opportunities for sustainable change. And again, funding opportunities again. So if we are looking at another research question, if we are looking at implementing a program that we learned works, being committed to helping with that process through identifying and securing funding opportunities to do so. And I really feel like one thing that kind of transcends this entire process, especially the sustainable outcomes, is the 7 generations mindset, which basically says that we can't only think about ourselves today and everyone existing currently, but what we need to do is learn from our past. From 7 generations ago, what did they know about, Native people have been doing their own research for centuries, and what can we learn from our ancestors, but also are we considering the future generations, 7 generations ahead, in the decisions that we're making today? Obviously, those are going to carry forward and have a huge impact on today's Native population, as well as those that are generations to come. So I think really listening to the stakeholders from communities on future research or policy ideas can really help to identify opportunities for sustainable outcomes. And then again, that support for the funding or programmatic efforts to make sure that good things are coming from that. I'll go ahead and wrap up here. We've been kind of on a journey through talking about public health concerns in tribal communities, opportunities by using tribal sovereignty to create positive change for the health of tribal members, and then kind of closed with more of a research focus on using that research to drive that policy change, and how to do that in an equitable and reciprocal way, so both parties are seeing benefits. The tribal communities and the researchers themselves are making gains from the research that's happening. So with that, I thank you for your time. I hope that some of this was useful, and if the entire framework itself can't be of use to you in your role or any of the public health opportunities, I hope that there's at least pieces of this that maybe you can consider into the future and use to benefit the population, whatever that may be, that you'll work with in your careers. Thank you. Have a good day.